As the world continues to fight COVID-19 after more than a year, 15-year-old Jay Foley is also fighting their own life-threatening illness, anorexia nervosa.
This goes for all eating disorders. It is a mental illness. It's not just this feeling of insecurity or struggling with body image. That is a huge part of it. But specifically for anorexia, it's this want for control in your life. And mine definitely, everything kind of started when COVID happened, because there was the mixture of, I don't like the way I am at the moment, and the world is ending.
The family lives in British Columbia and started looking for help last March. After going to their doctor and eventually an eating disorder clinic, they were hopeful. More than a year later, they are still waiting, and Jay's mom, Pam Devins, cannot understand the delay.
I thought we were in a line, but Jay's just not apparently sick enough. And that's a really sad thing to think, because they struggle every day. The longer they wait for treatment, the harder it is to treat. So that eating disorder is digging in like a tick with each passing month.
Hours after our interview, Devins told Global News she had received word Jay would be starting an eating disorders program at the end of June, news she called overwhelming. And while Jay may get the help they need, their story is not unique. During the waves of COVID-19, doctors and healthcare professionals have been warning of a shadow pandemic due to a surge in eating disorders among youth. Dr. Deborah Katzman with Sick Kids Hospital in Toronto says youth were coming in sicker and at a lower weight. She believes the rise in eating disorders among youth, which became more obvious around August 2020, may be partly due to safety concerns over coming into hospitals.
Parents really have expressed concerns about coming to the hospital for fear of contracting COVID. And so they're reluctant to come in and perhaps waiting longer to get the care they need for their young people who are sick with an eating disorder.
Earlier this year, Sick Kids, which sees young people between 8 to 18 years old, released numbers showing the mental health demand among youth between July 2020 to March 2021 compared to the previous year. Eating disorders saw one of the biggest spikes, with a 55% increase in admissions. Similar surges in youth coming in for care due to an eating disorder are being seen not only in Ontario, but across Canada. The National Eating Disorder Information Centre, which operates Canada's national telephone helpline and online chat service for people of all ages, has also seen higher numbers. NEDIC.ca Chat, which is how 2/3 of clients connect, saw a 52% increase in use in May 2020 compared to 2019, with over 7,000 hours of support provided. In the past year, there was an 80% increase. Ari Maharaj says those numbers may have a connection to the various reopenings seen as COVID restrictions were lifted.
I think when those conversations of hope happen, that's something really nice to latch onto. And I think we also have to recognize that I think that means that many people who might have been struggling over the course of the last 15 months are finally feeling comfortable that they can reach out and maybe get help from something that they've been harboring for so long.
While many eating disorders exist, Sick Kids reports a prevalence of cases of anorexia nervosa, while NEDIC has seen an increase in people reaching out about binge eating.
Kids are disconnected from their peers, and peers during late childhood, adolescence is really, really important. With school closures, there's lack of routine. There's reduction of extracurricular activities, which kids really rely on, both socially and also for increased activity to get out of the house.
Katzman says increased time on social media can also contribute. While parents and teens waited to come in for treatment, the wait lists others were on to get help saw delays as well.
I would say wait times have always unfortunately been a challenge in child and youth mental health and in eating disorders. The pandemic has definitely amplified the problem in terms of longer waiting lists for care.
Maharaj says the pandemic appears to have exacerbated a problem that existed well before COVID-19, with the helpline hearing of wait times for hospital-based programs ranging from 6 months to a year. He says more funding is needed to improve the quality of service and to spot issues early.
We should be able to give people care, just like how we do for the flu or any other kind of illness, in their community right when they're noticing it.
After their struggle, Jay says no one should have to wait that long to get help.
This isn't something anyone should have to live with, and waiting for 6 to 8 months to get help, even when you've reached out yourself saying, I don't want to live with this, I want to get better, which is rare because everything in your body tells you that you shouldn't be doing that. And you are told, cool, hold on. That's bull.
With COVID-19 not going anywhere just yet, Katzman said parents can help curb the increase in eating disorders by keeping routines in place, bringing in creative activities to give kids and teens something to look forward to, and help them stay in touch with friends and family.
Communication can help kids feel less alone, and it can also help mitigate some of the stress that comes from being away from friends and family.
Healthcare professionals say the pandemic has had a profound impact on youth, and they need to respond properly.
An eating disorder is often misunderstood as sort of a benign kind of illness in childhood and adolescence, and it absolutely isn't.
Sean Previl, Global News.
Thanks for watching Global News. If you want to stay up to date on all the latest breaking national and international news, be sure to subscribe to our channel.